It is a genuine pleasure to serve under your chairmanship today. Yesterday, November 25th, was the day the world marked Red Wednesday, a day which aims to draw attention to the plight of those who are persecuted for their religion or beliefs. It also marked the International Day for the Elimination of Violence Against Women and Girls. To mark these 2 days, the All-Party Parliamentary Group for International Freedom of Religion or Belief put down Early Day Motion 1179. I thank those colleagues who've already signed it and ask others please to do so. In that EDM, we urge the government and the international community to act to mitigate the impact that Covid-19 has had on vulnerable minority communities globally and on women and girls from those communities who are doubly discriminated against because of their gender and beliefs. The chair of our all-party parliamentary group, the Honourable Member for Strangford, who led the call, together with the Honourable Member for Glasgow East, who's here today, to secure this debate. And we do thank the Backbench Committee for giving us time. The Honourable Member for Strangford is unable to be with us today. His compassionate voice will be much missed during this debate. As a Vice-Chair of the All-Party Parliamentary Group, I'm sure I speak on behalf of many of us when I express the most sincere thanks to him for his dedicated work for the persecuted. In my speech today, I aim to highlight with examples from around the world how, tragically, both government and non-state actors have exploited this global health crisis to violate human rights, in particular, the right to freedom of religion or belief, to show how living conditions have worsened for them, for those detained on account of their conscience, whether in prison or as refugees. I aim to illustrate how the distribution of aid and humanitarian relief is often biased or withheld from those with minority beliefs, and to speak of the spread of misinformation targeting minority religious or belief communities. There is too clear evidence of an increase in violence, both domestic and more widely, affecting those with particular beliefs. And I will demonstrate how, in other ways, the right to worship and manifest faith or belief has been curtailed. All of this illustrates how important it is for our government to be vigilant in pressing others to uphold human rights and fundamental freedoms during this pandemic, including in particular the freedom of religion or belief. And I look forward to hearing from the Minister as to how the FCDO in particular is doing so. In countries around the world, many marginalised religious and belief communities have faced intensified discrimination since the outbreak of Covid-19. According to the UN Special Rapporteur on freedom of religion or belief, anti-Semitic hate speech has risen alarmingly since the outbreak of the Covid-19 crisis. Many faith communities have even been blamed for the virus. The BBC has reported that in Somalia, the Islamic extremist Al-Shabaab group is warning Muslims that Christians are transmitters of the disease. Messaging like this is terrifying for the handful of Christians there, already forced to practice their faith in secrecy for fear of their lives. In India, Muslims face accusations that they were deliberately spreading the virus, and a campaign of Islamophobia in which Muslims were labelled bioterrorists and corona jihadists ensued, leading to many instances of violence and discrimination against Muslims. And for Christians in India too, life has become much more difficult during the pandemic. And this on top of a serious increase in anti-Christian violence over the last few years. I see the Honourable Member for Glasgow East nodding. Particularly, but not exclusively, in Uttar Pradesh. We hear problems in India of mob vigilantism, violence and surveillance of home churches by non-state actors. I will refer later to problems in India during this pandemic, but for the record here, we'll just thank again the Backbench Business Committee, which has already approved a separate debate titled Persecution of Muslims, Christians and Other Minority Groups in India. I hope that parliamentary time will be found for this much-needed debate very soon. Around the world, the scapegoating of minorities during this pandemic is a truly global problem. According to the Institute for Development Studies, in a significant amount of the nations which have encountered outbreaks of the novel coronavirus, politicians and opinion leaders have openly condemned religious minority populations under the guise of epidemiological containment through hateful messages on social media, public speeches, and official policies. Colleagues, this scapegoating has contributed to the many reports of individuals from minority communities around the world being attacked, denied aid, or otherwise prevented from accessing life-saving humanitarian interventions. Accounts of discrimination of food distribution and the biased distribution of humanitarian relief materials are widespread. The organisation Alliance Defending Freedom International, ADF, reports from the Gulf region. People have become so desperate they are forced to trade their religion for food. They are forced to convert to Islam for just one sack of flour. In Iraq, there are reports of Christian communities being the last to get necessary food and medical supplies. In Pakistan, there have been reports of NGOs denying food and aid to Hindus and Christians, or only serving them after Muslims have been served. Some members of the ethnic and religious minority Hazara group in Pakistan have claimed they need to disguise themselves if they hope to receive medical treatment or testing. One of the problems is that where national government aid is being distributed by local groups, or where foreign secular organisations use local staff at the front line of aid distribution, discrimination against minorities can occur at that point, regardless of the foreign organisation's central anti-discrimination policies. It is important that our government does what it can to call for mechanisms to be put in place to ensure that religious minorities at the front line of aid distribution, particularly UK aid distribution, do not face additional discrimination because of their faith. Certain states have also utilised the Covid-19 outbreak as an excuse to intensify persecution of marginalised communities, and not only through church closures. In Uganda, there are reports that the government's response to Covid-19 has systematically excluded religious minority groups by allowing only certain major religions to attend consultative meetings on the coronavirus response. And China has increased its interference and surveillance of Tibetan Buddhists under the pretense of attempting to tackle the coronavirus, even using contact tracing apps to monitor every movement of Tibetan citizens. Also in China, where the clampdown on freedom of worship over recent years has been alarming, the pandemic has sadly given an opportunity for state surveillance of religious worship by minorities to increase. In China, some church members who tried to meet for online worship were detained and had the police stationed at their homes to prevent them joining online services. I turn now to the plight of refugees and internally displaced persons. Many already live in overcrowded conditions, rendering them particularly vulnerable in the event of an outbreak of Covid-19. Many of them are from religious communities which have experienced rights violations which occasioned their displacement and internment in the first place, such as the ethnic minorities who fled Burma's decades, long years of conflict. Covid-19 has reached the Rohingya refugee camps on the Bangladesh-Burma border, leading aid organisations to warn of an impending humanitarian disaster. First-hand observations by CSW, Christian Solidarity Worldwide, in the Rohingya refugee camps confirm that social distancing, self-isolation and regular hand-washing are an impossibility. Elsewhere, the pandemic has highlighted failings in legal systems and criminal proceedings and has underlined the degree to which religious discrimination can be institutionalised in some legal systems. In Sudan, for example, the legal system all but ground to a halt on account of the virus. Cases involving church leaders and church property, already proceeding slowly, faced further delays. And overcrowding in prisons during the pandemic has posed an additional threat to the welfare of inmates. A large number of prisons are in Evin prison in Tehran, where conditions are overcrowded and unsanitary, and where prisoners have contracted the virus. Eritrea is of particular concern. There, a stringent COVID-19 related lockdown, enforced with violence by the armed forces, has provided the government with additional means of curtailing freedom of movement, which was already restricted. Tens of thousands of prisoners of conscience there, including long-standing detainees, Jehovah's Witnesses, are held in unsanitary and ill-equipped conditions where life-threatening, insufficient access to water, food or medical facilities make their plight desperate. An appeal by the UN Special Rapporteur for Eritrea for low-risk offenders and vulnerable prisoners to be released was rebuffed. Although information from North Korea is difficult to obtain, and I have the privilege of having been the co-chair of the All-Party Group for North Korea for some years now, last week there were disturbing reports about North Koreans with COVID-19 being left to die in so-called quarantine camps. The full impact of COVID in North Korea remains unknown, but we should not underestimate this, given the country's virtual complete lack of respect for human rights, their limited health system, concentration camps housing thousands of prisoners of conscience, and this coinciding with North Korea having suffered substantial food shortages this year. The All-Party Group is currently conducting an inquiry into human rights violations in North Korea as a follow-up to the UN Commission of Inquiry of 2014. There's an opportunity to contribute to this through our website, appgnorthkoreaninquiry.com, and submissions would be most welcome, particularly in light of the limited information on the impact of this pandemic in this country. Elsewhere across the world, it is clear that the pandemic has led to discrimination in employment. Open Doors report are being told of Christian nurses being deliberately assigned coronavirus cases. And when India went into lockdown to combat the coronavirus crisis, hundreds of thousands lost their jobs overnight. Many usually work as daily labourers and earn each day what they need to survive. Without the day's income, they have no money to buy food. Many work as sanitation workers, often from the Dalit community, the most neglected and marginalised in India, indeed I would say virtually in the world. It's heartrending to hear how some of them can only actually come out at night. Their work involves great health risks, collecting waste, emptying sewage, cleaning the streets. And we hear from Open Doors from Hyderabad how these people face a serious predicament and put their lives at risk, with even women sanitation workers performing these sanitation tasks without gloves, protective masks, and even shoes, often working by hand. And there is no financial safety net or furloughing scheme in India. Official aid is nowhere near enough for the people who need it. And as I say, sadly, Christians are often last in line for essential COVID food and aid because of their faith. However difficult the pandemic has been in this country, it has, as these reports show, and I thank in particular CSW and Open Doors for their reliable, often first-hand accounts. Difficulties in other countries are far more exacerbated for the vulnerable, for minorities and women. There's a second debate this afternoon on international development and gender-based violence, so I will not take any further time from colleagues in this debate by focusing on that now. Suffice to say that reports in the Lancet indicate that domestic violence against women and girls has increased by as much as 30% in some countries during this pandemic. This huge increase in domestic violence has led to several reports of women from minority communities such as Yazidis taking their lives. Tragically, this increase in violence is by no means restricted to domestic situations during this lockdown. In Nigeria, Kaduna and Plateau states, villagers there were obeying state directives to stay in their homes to prevent the spread of the virus. Sadly, this made them an even more vulnerable target for attack than before the pandemic, effectively becoming a sitting target. Fulani militants have carried out multiple raids on villages with reports of Christians killed. Christians believe militants are taking advantage of the pandemic to uproot them further from the area. And whilst they've made efforts to alert state security agents about these attacks, nothing has been done to prevent them. Once again, on behalf of our APPG, I call on government ministers to actively address the concerns and recommendations of our APPG report published earlier this year, titled Nigeria, Unfolding Genocide. And before I conclude, and I can assure you now, Mr Rossendale, I am doing so, I look forward to other colleagues' contributions, but can I ask the Minister to reflect, in light of this debate, on the Bishop of Truro's report recommendation number 21. I've spoken about this in a number of previous debates over recent years. He highlights the importance of recognising the negative consequences of the mantra of what he refers to as need not creed in delivery of our aid, of rejecting this mantra, and of the negative consequences of our aid being so-called religion blind. Can I also ask the Minister to consider the importance of challenging international partners to ensure disinformation is combated, that there is access to justice, that where religious communities are attacked there is accountability, that any emergency powers during this crisis are proportionate, and that during this unprecedented pandemic, and now more than ever, we need to ensure that the needs of and particular pressures on religious minorities are taken into account and not ignored.